Hi everyone, welcome on board to Helper.tv, where you get the reliable news that is tailored for you, and of course where you can actually comment and interact. I say a very big thank you to those who have taken time to subscribe to this channel, and if you're yet to subscribe, kindly tap on that subscription button and also the red bell icon so you will be notified whenever videos such as this are uploaded. This is very serious and also funny. Drama unfolded in Lagos State, and this happened in Gbagada General Hospital, as doctors and nurses were said to have eloped when they sighted 4 Caucasian men, oftentimes called white men. I've never seen anyone white. They claimed that these 4 patients had coronavirus and they were rushed into the hospital. Now, one would have thought that doctors and nurses are trained to handle such, but I believe that they weren't equipped enough and they are not prepared for such. On citing them, the nurses ran away saying, this is coronavirus. Coronavirus is not our portion. God forbid. This place is not IDH. And IDH is simply infectious disease hospital, and it is located in Yaba, somewhere in Lagos State. And they were asked to take them there, and they started calling in the security officials. Security, please come and send these people out of the place. I wouldn't even know how the security will actually, go to send away people that they claimed had coronavirus. This coronavirus is a pandemic. It has spread around the whole world. Until date, it has no cure. It is a disease, a virus that attacks the respiratory system, your lungs, and the rest of your system just goes off, and you begin to have symptoms after a few period of time. A witness said, so when they got to the emergency ward, nurses and doctors on duty came out to attend to them. But upon getting to the vehicle, they noticed that the 4 occupants were Caucasians, with one of them critically ill and coughing uncontrollably. Immediately, the nurses and doctors saw them. They all took to their heels. You know how this virus spread from Wuhan, China, Asia, and went down to Europe. It attacked Italy first. They had huge casualties, and it went into United States of America. America topped the list, followed by Italy, Spain, UK. You find it in France, everywhere. It's just everywhere in Europe. And the number of patients, people infected in Africa, is not much. So some of the nurses began to shout, this is coronavirus, and that they should take them down to infectious disease hospital. Security had to quickly come in. Security guards on duty had to quickly come in, and they had to summon courage from afar and order them out of the hospital because they were too afraid to come in contact with them, and they asked them to drive out. They were not allowed to come down from their vehicle. It is also revealed that everybody ran because some of the doctors said the symptoms that they saw were clearly that of COVID-19. Their visit truly caused commotion at the hospital. Another worker also testified saying all workers at the hospital have been warned not to attend to any foreigner, and anybody whose body temperature is above 40 degrees is not allowed in. In fact, they said, according to World Health Organization, 37 degrees Celsius is the temperature that they have to actually take you in, self-isolate you, and test you. The source added, the situation, the presence of the 4 Caucasian men affected patients on admission, as many of them withdrew their sick relatives immediately and loved ones after the incident, and they decided to get out of the hospital as they know that coronavirus is more deadly than probably the health issue that they are dealing with. Dr. Adeleke Kaka, who is the medical director of the hospital, confirmed the incident but denied the fact that the doctors and nurses took to their heels. He disclosed that it was only 1 Egyptian suspected to have coronavirus that was brought to the hospital and not 4. Kaka said the guy was suspected to have COVID-19 by the doctor that saw him in a private hospital and referred him to Gbagada General Hospital. He was sent to Mainland Hospital for further evaluation and further testing. So I believe that information should be given out properly, so people that have this health issue, in fact, there should be a specific, a dedicated helpline that people can call toll free of charge to call in medical staffs that are trained and equipped to handle this
This is what it's supposed to be. That's how it is everywhere. You don't come out of your house, because coming out of your house, you might infect people with this. Although in some countries, if you have your personal car, your automobile, you can actually drive down to be tested. But if the virus has already hit you so hard, you will have to stay indoors and call in the doctor. So at this moment, there's a toll-free number out there. If you are in Nigeria, I'm going to quickly call out this toll-free number. This number is what the NCDC has put out there for you to call. NCDC, that is the Center for Disease Control. They've put out this number for you to call toll-free to report whatever health challenges you are having as regards coronavirus. We haven't heard at the moment if anyone has called the number and if any of the staffs have visited them. We don't know how efficient this is, but you can give it a try anyway. So I'm going to quickly call this NCDC toll-free number. It is 080097000010. That is the number to call. And they are also on Twitter and on Facebook at ncdc.gov. You can check them there /covid19.ncdc.gov.ng. That is they have the Twitter. Twitter is at ncdc.gov. The Facebook handle is covid19.ncdc.gov.ng. This is a dedicated number, the one I called earlier. You can actually call to find out what is going on. If you need further information, probably this same helpline might be available for you to call to ask, so that you can get yourself educated as regards what's happening. I believe this is also available in countries out there. Western countries have also created a dedicated toll-free line that you can call if you have symptoms. And I believe a lot of people have, most countries are on lockdown, and some people that might have contacted people, or probably they went to a place that some countries where there are higher risk of this infection. Many of them have self-isolated. The people that already have the virus, the symptoms already, they have been quarantined. And I believe that, probably you are there in Europe, sitting down in your room listening to this. It's good that you take precautions. Very, very important. And now let's go back to the issue of the hospital. Either it is 4 people that came, or 1 Egyptian, or 4, or whatever it is. I think at the moment, aside the hospital in Yaba that is especially built for infectious disease hospital, IDH in Yaba, I think that at this moment it is very wise, to be a very wise thing for hospitals, either private, to make sure they themselves take adequate precautions, medical precautions, according to World Health Organization. At this moment, I don't think that there should be any medical staff without the nose mask, not the cheap one that we see around. There are specific nose masks that work. They have filters and all of this. They are for this. And you should also make sure that your hands are sanitized every time you wash your hands, and you do this often. And make sure that you don't keep reinfecting, transferring the virus from, one point to the other if you already have this virus. And for those that make use of the nose masks, I've found out that a lot of people keep touching the nose mask, and the mask every minute, every second. It's still the same thing if your hands are not sanitized. And if you've come in contact with someone that has a virus without your knowledge, probably you touched a particular object and you're using that to touch the same thing, still the same thing. You are only infecting yourself through the same masks that you are using to cover yourself. So it's very important that we take note of all of this, because people think if we put the mask on my nose, that's all, and that's the end of it. No, in fact, you need a special mask, not the one that I'm seeing everywhere. That would not work. It is only good, the mask only works for people that already have the virus itself, so that when they probably sneeze, it won't come out and infect other people. But for you, I don't think that will be able to, you need a special one anyway. So, and if you are already having temperature of 37 degrees upward, you should quickly call that number that I called out to you. So I believe that hospitals in Nigeria, they of course they are trained. They even have more knowledge as regards all of this than what many of us have. So at this moment, I believe that they should have themselves kitted up. Any patient, it doesn't matter if those people have the virus or they don't have the virus. At this moment, all general hospitals, state hospitals, teaching hospitals, private hospitals, they should guard themselves at this moment. Anyone that is going to welcome in any patient already should have the protection, and they should test all patients, the temperature, before they admit anybody in, so as to avoid the spread of this virus. So that's what it is for now. If you are not a member of this channel, let's build it together by you tapping on the subscription button and the red notification icon bell. It will alert you whenever our videos are uploaded. Thanks for stopping by.